Hi, this is Dr. Jonas Leibowitz, an endocrinologist with 30 years of experience, here to review inaccuracies of the hemoglobin A1C result. Sometimes the hemoglobin A1C result may not match what you expect it to be. There may be what we call discordance between what the sugar is or what the patient may be seeing with the sugar results and what the A1C is. Sometimes that A1C test may be artificially high. Although this is probably not as common an issue, it may occur if the red blood cells, that's what the hemoglobin is, lives a little bit longer, perhaps in the setting of a B12 deficiency. It may also read higher if someone has a variant to hemoglobin. So when we say someone has hemoglobin A, that A is the type of hemoglobin that they carry in their bloodstream. You may have heard of sickle cell, people carry hemoglobin S, or fetal hemoglobin, hemoglobin F. There are also variants of thalassemia, where the hemoglobin molecule may not be the typical hemoglobin A variant. So those could result in levels that could be high or low. More likely, a low hemoglobin A1C may be an artificial result. This is something that you may see if the blood cells have had a shortened lifespan. So for instance, if a person is having bleeding and their blood cells are leaving their body quickly, so there are new, younger cells that haven't had the full 90 days or so for the sugar to stick to them, or someone who's getting a medicine, like a kidney patient, a dialysis patient, that may raise their red blood cells by causing more red blood cells to grow quickly. Those patients may also have an artificially low hemoglobin A1C. So those are some of the things we can see. I always like to talk about the patient in the hospital who gets a transfusion. So sometimes when I see a new patient who seems like they have a bunch of medical problems and they may be sicker than we think, I'll often say, hey, have you had a transfusion in the last 90 days or so? Because guess what? That blood is not theirs. That's someone else's blood. And there probably aren't a lot of diabetics among the blood donor pool in the communities. So most likely the blood that's flowing through their bloodstream, through their blood vessels, is probably with less sugar in it. So those patients may have an artificially low result. So it's important to take into account that if you think the A1C may not match what you're thinking it should be, then it may not be fully accurate. But that's an exception, not the rule. But it is something to know.